panel on gender and COVID-19, setting a research agenda that really examines what gender means, a gender lens in looking at these issues in research priority setting in the Asia-Pacific region. I'd like to welcome everyone. Thank you for joining us with the multiple webinars going on around the world. This is actually very important, and I thank you for making the time today. I want you to introduce yourself in the chat box, just to save time, because we have an hour for this webinar, and post your questions there. We may not be able to respond to the questions, depending on timings, but Dr. Lavanya has assured us, who's a postdoctoral fellow at the United Nations University, there will be a blog responding to some of these questions. I'm a medical anthropologist. My name is Dr. Sabina Faiz Rashid. I'm a professor and dean at the Bragg James P. Grant School of Public Health at Bragg University. A lot of my research is ethnographies, looking at vulnerable populations and looking at women. Just to let you all know, we have about an hour. We're going to have two presentations from Dr. Lavanya and Kalani, and then we're going to have a panel with some very esteemed speakers with very different kinds of backgrounds and work, from WIPRO, from Bill and Melinda Gates Foundation, and from the Third World Network. And then we're going to have possibly some very quick discussions around interventions, and then possibly a wrap up with some final sort of points or messages to all our audience and to each other as we learn from each other today. So may I, basically, it's really to inspire a call to action, to think critically and reflectively around gender and gender lens, and how do we unpack that in the work that you're doing, in the context that you live in, and reflecting on this. And today is the day, or this evening or afternoon or morning, it's morning in Bangladesh, it's 9 a.m., to think about these issues. So I'm going to ask Dr. Lavanya, postdoctoral, to actually start off with a quick presentation on introducing some of these issues. Thank you very much, Dr. Lavanya.
Thank you, Professor Sabina. Thank you, everyone, for being here today, making time for us this morning. So the aim of the call, I'm echoing what Professor Sabina has just said. The aim of today's call is simple. Look, we're far from vaccinating the entire world, especially with the push for booster shots. So the ask is to take urgent action to tackle the gender-related barriers and inequities in vaccines research, policy, and rollout. So a little bit about the work that we're doing. This event is part of the Research Agenda Setting Initiative for Gender and COVID-19, which started late last year. Look, it was great that the influence of gender was picked up early in the pandemic. We saw gender disproportionate outcomes and negative consequences of the policies, but a lot of the issues were anecdotally reported. Gaps in data systems meant the issues were largely invisible in many parts of the world, and particularly within marginalized populations. Hence, the need for a shared and prioritized research agenda to inform research investments and address these data gaps within local and national contexts. So we opened a global call for participants, conducted online discussions across 5 thematic groups, distilled those conversations into reports, and then compiled a long list of research questions. We then invited participants to consider the benefits and urgency of questions through a prioritization survey, which ended last weekend, and now we're analyzing the data. We've also been having regular webinars to share our progress, receive inputs, and have regional conversations such as this one to hear context-specific needs. My colleagues will be sharing more information on this initiative in the chat for your reference. So here are top 5 priority questions on gender and vaccinations that's coming out from our early analysis. Well, as you can see, it spans the trajectory of the rollout process. How does sex and gender influence vaccines outcomes, acceptance, and uptake? What are strategies that work to address barriers in deployment? But first, why are these research questions important across each context? So essentially, if we neglect or inconsistently consider the influence of sex and gender, we will have fragmented delivery, demand, and access that result in coverage gaps and delayed population protection. This leads to increased burden of preventable morbidity and premature mortality from COVID-19 and other conditions, delayed economic recovery, widened gender inequalities, and of course, violations of rights in society. When the vaccines hit the market, the old stories of the gender barriers in health access in general and vaccinations came out to play again, and they're still playing out. So early reports from some high-income countries initially suggested that more women were getting vaccinated by virtue of prioritizing frontline workers. But then, of course, the low and middle income experience contrasted to this. More women and marginalized groups are being left out. And I invite you to refer to the Global Health 50/50 tracking of sex disaggregated data on vaccinations for further review. So to support the integration of gender responsive action, this guidance note and checklist was published by the SDG 3 GAP, Gender Equality Interagency Working Group, in collaboration with the Gender and Health Hub at UNU-IIGH to address the known and anticipated gender barriers, inequities, and inequalities in national and local vaccine deployment. My colleagues are posting links to this resource, including our past webinars in the chat. So the action call to address gender-related information, resource, and process barriers based on these domains. These are already identified in the broad COVAX guidance for deployment planning. These include considerations of sex and gender right from the start in regulatory decision-making, in the planning and financing at scale, in the collection and monitoring of real-time data, in the implementation of human resource needs, targeted delivery strategies, including effective customized science communications, particularly for the priority and high-risk marginalized populations. And so I'm circling back here now to say that the way to do this is to address and act on the known and context-specific barriers, but in many cases, prior research and data is not available. And hence, this is really why we need more research. So I'll stop here and hand over to Sabina. Thank you.
Thank you very much. Can I ask Ms. Kalani, and Ms. Kalani, can you please introduce yourself briefly and share your short presentation about the listening session? Thank you very much.
Hello all, and thank you so much for joining. Thanks so much, Lavanya and Sabina. My name is Kalani Robertson. I am representing UN Women Regional Office of Asia and the Pacific and the Gender and Humanitarian Action Working Group. Earlier this year, we recently convened a virtual listening session with women-focused organizations on the COVID-19 vaccine rollout in Asia and the Pacific, focusing on diverse perspectives from across the region and on issues related to the COVID-19 vaccine supply and demand at a time when vaccines were initially being rolled out globally. Could we go to the next slide, please? Thank you. The discussions and recommendations resulted in the publication shown here, and I can share the link in the chat as well. Some of the most common barriers that prevent women from receiving vaccinations are a lack of information, social norms that are discriminatory towards women, and decisions that fail to prioritize women's health. Gender gaps in literacy, education, and technology mean women are less likely to receive relevant and trustworthy information about COVID-19 vaccinations. And there are further challenges for specific vulnerable and marginalized groups with intersecting identities, such as issues with lack of national identity cards for refugee, migrant, or displaced populations. Could we go to the next slide, please? We framed the conversation with the guidance note and checklist developed by Gavi that Lavanya referred to earlier, that was made collaboratively with UN Women, the Gender Health Hub, and our partners, presenting key actions for countries to prioritize in order to tackle gender-related barriers to equitable COVID-19 vaccine deployment. Next slide, please. Our panelists represented voices of youth, women with disabilities, and women in conflict settings, and discussed challenges, including personal accounts relevant to specific marginalized groups. Agatha, for example, discussed the difficulty of people in the deaf community to access trustworthy information to know how to access COVID-19 related services, including vaccine deployment. Next slide, please. During the listening session, we separated into two breakout sessions to discuss supply and demand side issues. and the women-focused organizations that participated expressed a variety of gender-related barriers in access to and supply of COVID-19 vaccines, such as physical, administrative, social, and information accessibility issues. The issues related to the vaccine inequity and the exacerbating effect it had on widening social inequities and disparities, particularly across certain demographic groups. The impacts of poor management within supply chains, and issues with exclusively digitized vaccine information and registration systems. In the publication, we also provide key recommendations based on these points. Next slide, please. To complement the results of the listening session, we also conducted a gender analysis in the region looking at the Global Gender Response Tracker developed by UN Women and UNDP, a unique database that monitors policy responses to the pandemic and a data set on women's representation in COVID-19 task forces. It focused on measures that address three key challenges: the surge in violence against women and girls, the unprecedented increase in unpaid care work, and the large-scale loss of jobs, incomes, and livelihoods across 187 countries. Of these, only 42 countries, 19% of those analyzed, have a holistic response with measures that span all three domains. Worryingly, almost the same amount seem to have no gender-sensitive measures in response to COVID-19 at all. And more than a year into this crisis, the ways in which COVID-19 affects women and men is still unclear due to the lack of comprehensive sex, age, and disability disaggregated testing, case, and mortality data. As a result, what we can know about the socioeconomic impacts of the pandemic has a lot of gaps. Next slide, please. It is clear that through lived experiences during the pandemic, there are starkly divided among gender lines and are exacerbated by intersecting identities and vulnerabilities. Refugees and internally displaced people, people living with HIV, people with disabilities, LGBTIQ communities, young girls, migrant workers, minorities and indigenous populations, populations living in rural or hard to reach areas, people living in climate-affected communities, and those living in extreme poverty have been disproportionately impacted by the pandemic and are frequently shouldering the socioeconomic burdens and are constantly undervalued and overlooked in decision-making positions. In order to move forward, we need to engage in gender-responsive ways, such as through the collection and availability of sex, age, and disability disaggregated data, as well as information and data on other at-risk groups, and ensuring women with diverse backgrounds and from different socioeconomic strata are given opportunities to meaningfully engage in the structures, measures, and processes. Next slide, please. Lastly, here are some key resources that you can engage with on your own time. I hope that these tools will be useful towards ensuring further advocacy and research efforts. Thank you so much for your time. Back to you, Sabina.
Thank you very much. It was very interesting listening to Dr. Lavanya and listening to Kalani Robertson, because we're talking about issues that are gender, but also vulnerabilities, groups at risk, the heterogeneity of the populations, disability. You could have elderly in Bangladesh, you have widows, female-headed households. You've got also refugee populations, but also very poor men. And what I'm hearing is, beyond the general barriers, the sociocultural barriers, there's also the infrastructural barriers, access to digital, internet services, the registration, ability to register, mobility, the voice and ability to actually say, we need vaccines or we need support. And I think it's very important to kind of discuss some of these issues. So very, very interesting. Thank you so much. And thank you for sharing all the resources. I hope the audience, I myself will be helping myself to some of these resources. So I would urge everyone to kind of access these resources. Thank you very much. So now we're going to the panel session. Let me quickly introduce our three speakers, and then we'll go into the questions. So we have, if I could ask everyone in the panel to show your face online. Thank you very much. Good to see you. And good morning from my end. We have Dr. Kira Fortune, who's from WHO Wipro. I'm keeping it short. She has extensive experience, but she's really the coordinator of the unit on social determinants of health and violence and injury prevention at the regional WHO office of the Western Pacific in Manila. comes with a lot of experience in gender mainstreaming, health equity, community engagement, etc. Then we have Dr. Gunjan Taneja from the Bill and Melinda Gates Foundation in India, a program officer with more than 11 years of experience looking at vaccine delivery, and also looking at, has a postgraduate training in community medicine, and really looking at district, state, and national level of work in the country. And then we have Ms. Chi Yok Ling. I'm going to refer to you as Yok Ling because Chi is your family name, is the executive director of the Third World Network, an international policy research and advocacy organization focusing on sustainable development issues, the South and North-South relationships. These are all very important, particularly in this climate. It's always been important, but I think COVID has magnified certain issues that have always existed. The embedded inequalities, inequities, the power dynamics, where the lack of accountability, and raised many, many other issues, which, if we look at a macro, micro scale. But I'm going to first start with a couple of questions to Kira and Gunjan, and then go to Yok Ling. So Kira, I just wanted to know from your own experience working at Wipro, what are some of the research needs and areas? What are some of the issues that have come up if you're looking at, gender dynamics around trust, hesitancy, uptake, or any other issues that have come up that you'd like to see prioritized in the region on gender and vaccination? So a couple of minutes, I'd love to hear from you. Thank you.
Thank you so much, Sabina, and good morning, colleagues. It's a real pleasure to be here with you this morning and for this really important and very timely discussion. So I think that if we are to better understand the research needs on the gender dynamics around vaccine trust and hesitancy, then we really need to address the broader structural gender inequalities. And to provide a little bit of context, I always like to start by saying that 2015 was a very historic year. As you know, it was historic in the sense that the global community concluded the Millennium Development Goals, but of course, also adopted the Sustainable Development Goals agenda. And this, of course, was a time to take stock of progress. And I think it's fair to say that the Western Pacific region had much to celebrate, as we saw an increase in life expectancy, a decrease in under-5 mortality, and a decrease in extreme poverty. But at the same time, there was also this recognition that not everyone had benefited equally from this progress. And in fact, inequity and gender inequality do continue to be two of the greatest challenges of our time. And 6 years on from adopting the SDGs, we are now living through a pandemic, and some of the key gains that were made are now at risk. Now, with COVID-19, we are, of course, seeing new vulnerable populations emerge. And I think it is important to highlight that approximately 90% of the world's school children were confined to their homes in April this year. And in the Western Pacific, for many households and lockdowns, they have seen incomes and savings disappear, and meaning that they will simply not be able to pay school fees. And often boys are now being prioritized. And here we're seeing evidence that gender norms means that girls are also being burdened with additional caregiving and domestic duties. And in times of economic hardship, it's indeed difficult to reverse that. We also see new challenges, and you spoke to that just now, Sabina, in terms of the widening gap of digital literacy. And this, of course, is affecting men and women very differently. And in fact, a very recent report published by ESCAP shows that 52% of the population in the Asian Pacific region, spanning over 53 countries, are not connected to the internet. So gender inequality is evident in terms of access, ownership of digital devices, digital fluency, as well as a capacity to make meaningful use of the access to technology. And even though that affordability is a key source of exclusion, we also know that significant socio-cultural norms restrict access for women. And then I would say that we also know that women make up 70% of the global health workforce, but only 30% of the global health leadership positions. So women are therefore more exposed to risk at the front line, and their voices are less likely to be heard in the global response, given that they have limited representation where decisions are being made. So in addressing the gender dynamics in vaccine trust and uptake, it is, of course, essential to address these different gendered structural inequalities. And what we've done here in the region as well is that we've conducted a number of behavioral insight surveys, and I won't go into all the details, but just to flag sort of a few of our findings. We found here in the regions that 40% of the people interviewed worry about violence at home. We also found that women in particular have concerns about the vaccine effect on fertility, but they also often are not comfortable about expressing these concerns due to fear of stigma. And some respondents highlighted that they were challenged around reaching health facilities, demonstrating financial barriers, which of course may limit indirect costs associated with accessing vaccines, along with long wait times or inflexible
Thank
hours.
you so much. I think we're going to come back to you because you have so much to share.
Yes.
I think we come back, do the rounds of all the other experts, and we can have a bit of a, a final kind of messaging. But thanks so much. Very interesting. You're kind of introducing many different kinds of layers of thinking that, and building on what Dr. Lavanya and Kalani shared. But Dr. Gunjan, I mean, I'm coming to you because some of this must be very familiar. But looking at country level experience in programming, research needs, are there similar kinds of issues that we need to look at or prioritize? Or are there other issues that you could add to complement what Kira was just shared? Just briefly in a couple of minutes. Thank you very much. Yeah.
Thank you so much, Sabina, and thank you again for this wonderful opportunity. I think I'm audible. Just checking, am I audible?
Yes, you are. But if you could speak a bit louder, it's maybe just me. Thank you.
Sure.
Yeah.
So at the country level, I think there is now definite acknowledgement that gender dynamics or gender has an impact on all program processes, be it immunization or other programs. And taking the cue from the COVID vaccine rollout, I think that has only prioritized this. So today is a momentous day for India. We are going to hit 1 billion vaccine doses being administered across the country. And women have been administered 48% of the doses, which is more or less in accordance with the population proportions that we have in the country. But that was not always the case when we had the second wave of the pandemic, and there were also some issues with vaccine availability. That is when the women least doses were being administered to women in the country, and that is supported by anecdotal evidence, not only anecdotal evidence from the field, wherein we are working with our partners, the UN organizations, CHAI, JSI, of men getting prioritized at the family or at the community level. But even from data, we saw that women, specifically in the urban areas and in the age group of 18 to 44 years, were the least likely to get vaccinated. So within the programming context, I think this aspect is now being prioritized. Governments are looking at it. And similarly, even in the context of vaccine hesitancy, we have seen how different assessments through governments and partners have brought up different measures and reasons of vaccine hesitancy amongst males and females in the country. For example, the Facebook CSS survey points towards fear of side effects being more accentuated in women at 40% as compared to men at 30%. So this is all good. I think what we need to look at is, and taking cue from Dr. Raj Shankar Ghosh, who's a senior advisor for vaccine delivery at the foundation, we broadly need to look at 4 program areas: demand, access, supply, and human resources. The other aspect, however, what we need to consider is also the perplexities which the immunization program per se brings to the forefront. Now, traditionally, we have been using sex disaggregated data. And at the outcome level, often coverages for males and females or boys and girls is more or less the same. So what we take is it as a de facto, let's say, indicator of program performance, and often a tacit acknowledgement that we are doing good on the gender front, since boys and girls vaccination rates are equal. But what we really need to do is to dissect the program, go back and look at the story beyond the numbers. And there have been recent papers in BMJ Global Health, which very well highlight the issues and concerns at the individual, family, community, health systems, and policy making levels, which actually impede access and utilization of services for equity determinants, gender being one of them. and specifically, I think, for the marginalized and population groups, as Kira was just mentioning. So what we need to think, I think, move on, or what I look at is that as a 3R framework. I think realize, reflect, and respond. So now across all the stakeholders, there is realization that gender has an impact, is an important equity determinant. We need to look at it. What we need to now do quickly is to reflect on what is working. There have been multiple efforts, even within the COVID vaccine rollout, when the coverage in women was low, access was identified as a major challenge. And the program was actually taken to the community, and also specialized booths were set up for the women. So we need to reflect, and then finally, we need to respond appropriately, adequately, in an accelerated manner to correct the things that still need to be corrected.
Thank you
And
so much.
Overall,
I was just going to come back to you. Sorry to cut you off.
Sure.
You know, I think it's very interesting. As I said, we could do like maybe a week on this because there's so many issues. It's so multi-layered. It's quite complex. But a couple of things that just came to mind very quickly for me was, you know, what do we need to think about in terms of research methodologies? We're talking beyond numbers. What are we thinking about when we look at the heterogeneity of different vulnerabilities in groups? And what does it mean to unpack gender in these contexts? But before we come to Yo-Kling, just a final two quick questions to both you, Gunjan and Kira, is if we had to look at the next, 12 months, because vaccine, hesitancy, trust, uptake, other issues are kind of going on. I would like to ask, Kira from Wipro, like, what kind of action points do we need for further research to inform programs and policies? And to Gunjan, if we're looking ahead of this, are there spaces or areas, given you've come from the foundation, for collaboration between CSOs, other multilateral agencies? Are there any program initiatives or funding available looking at these particular issues? So very quickly, Kira and then Gunjan, and then I'm going to go to Yo-Kling. Thank you very much. Yeah.
Thank you so much, Sabina, and I will be brief. I think for us, certainly community engagement has been a key entry point to really address gender inequalities and health inequities. Very early on in the pandemic, we were tasked by our regional director to establish a regional movement on community engagement addressing COVID-19, but also beyond. And very quickly, our movement identified three core priorities that's guiding our work. That is, working and building partnerships within, but also beyond the health sector, working with community volunteers, and really building on local governance mechanisms to again further strengthen the work that we do with communities. And I think what we have done specifically under this movement is that we have established an initiative with 11 civil society organizations that we're really looking to scale up. And we again have found that this has been a way of, again, better understanding the knowledge at the community level that will eventually inform policy. But it has also been an opportunity to work at the local level with communities to again, address gender-based violence, to address vulnerabilities, to work hand in hand to look at where are the needs, and also to better understand those that will not be able to follow the generic guidelines of the WHO in terms of because they don't have access to safe water, or they might not be able to self-isolate. So again, we found that has been a key a vehicle to address those that are most vulnerable, and also again a way to ensure that those that are often left behind and those voices that have not been at the table, that they're there to inform the response. Back over to you, Sabina.
Thank you. I think it's really important because what you're referring to is context, working from a bottom-up approach, really engaging with key stakeholders who are as invested in the communities, and engaging with communities themselves in their heterogeneity. Dr. Gunjan, would you like to share a few words about partnerships, collaborations, initiatives?
I think wonderful work by the team at the Gender and Health Hub, and the prioritization survey gives us important action points. I'd just like to take a step back, and it's essentially the alignment and acknowledgement amongst the different stakeholders who are involved in this to set their priorities right. we need to talk in unison and I think and understand that the needs of the governments and the communities or different stakeholders might vary, but we have a common goal and objective towards which we are working. So for us at the foundation, I think it's the government and the communities which are the change makers, and all the partners, the researchers, the academic forums are essentially at the catalyst. We have also been advocating now for gender to be ingrained along with the other equity determinants across all our investments and projects, from vaccine development to deployment. So that is something which is very close to the work which we are doing. As Kira mentioned, there is a lot of focus on this from the UN agencies, I think, which will only amplify the efforts. It's an important challenge which we are looking to. We need to prioritize it for the governments and the communities. And I think the onus lies on a lot of people on this call to make sure that the governments and the communities, I think, and prioritize it at their end. And finally, be it cross-cutting themes across the region, across the globe, or more local and contextual themes, I think these themes, research needs, agenda needs to be set in collaboration with the governments and the communities. And as I said, the other stakeholders adding their own flavor and mix to it.
Thank you very much. Very interesting in looking at, and I think one thing you kind of flagged, which is very important even in the Bangladesh context, is governments are a key sort of partner, but not only that, they're the drivers of this, and how do we get everyone working together? And of course, there's the local, global, regional, all kinds of other challenges, but we're not going to discuss that today. But thank you very much for talking about the initiative and the interest. Now we're going to go to Yokling, and we'll come back to you for your final rapid fire responses if we have time. So thank you so much. Very interesting, very informative. Yokling, I know that, you know, with the work that you do as Executive Director of Third World Network, it'd be very useful to briefly define, because, you know, we're to the audience, we're kind of switching now to health security, international relationships, capitalist practices of industry. So we're going to get into some of the thorny issues that exist in this very messy world that we live in. As we all know, we're always navigating, negotiating, or up against all kinds of power relationships and structures that bear down on the work that we do or try and do. And I think it's very important to hear that voice, to challenge us to reflect critically on these issues that we're up against. So could you tell us very quickly about some of the issues around the legal trade implications of TRIPS, WTO, patent laws, and then I'm going to go into question 2 and 3. Thank you very much. Yeah.
Thank you very much, Sabina. You know, back in the late 80s, the Pfizer CEO at that time, he very systematically lobbied the United States government to include intellectual property as part of the United States foreign policy. Well, what does this mean? It means that wherever the United States government goes, whether it's trade negotiations, whether it's bilateral negotiations, it will be about making sure that the private monopoly rights through patents, trade secrets, copyright, trademarks will be very much more secure. And it was the same Pfizer CEO who organized industry associations across the United States, Europe, and Japan with their counterparts, and lobbied the governments of Europe, Japan, and United States to introduce intellectual property into the so-called trade agreements negotiations, which leads to what we have today in the World Trade Organization. I want to emphasize this because fast forward today, Pfizer is the same company that will put profit before lives. So what do we see on the front page of business newspapers, in the medical journals? Genocide against humanity, profiteering. So there is rightfully outrage going on. And why is that so? So until 1995, every country had the freedom to even decide whether or not to give patents for medicines. You could exclude it. And that's why countries like India and Bangladesh have been able to build a domestic pharmaceutical industry into R&D as well. But in 1995, the intellectual property agreement called TRIPS, which is administered by the WTO, came into force. And that changed our lives around the world. Because under this agreement now, all countries members of the WTO, which is most of us, will have to give minimum 20 years patent protection for all products and technologies and processes that meet the criteria. And that is, at the country level. So while we talk about vaccine equity, it is about supply. right, today, because we know that the monopoly is given. So we are now relying on the voluntariness of companies to see which companies they will give licenses to. So there's no question that we have a big problem. And so many countries, before COVID, we had already faced high prices of medicines. It's not new. From HIV to hepatitis to cancer drugs. Even in the United States, the richest country in the world, has the most expensive drugs. So those inequities in terms of gender impact. So when we talk about, you have no access. So in the whole system, there has been no access for many, many years. But it's nothing to be, it's not set in stone. And because the pandemic requires unprecedented responses, there is a temporary waiver call, which is to suspend the implementation and enforcement of these types of intellectual property for a minimum of 3 years, and then we'll review the situation. This is the big fight going on in WTO, and we are very proud that it came from the South. India and South Africa, drove this. But we are finding lots of resistance. The Biden administration took a softer stand, but now we have Europe, actually the 27 countries led by basically Germany, is blocking this. And waivers are nothing so spectacularly, unusual. It's in the WTO system. For emergencies, you can suspend any of the agreements in the World Trade Organization. And that is a very logical thing to do. We have many countries in Asia are co-sponsors, and we have more than 100 countries, including the softened, Japan, United States, Australia just joined. So this is where we are. So we want the EU, UK, and Switzerland to not block. Let's open up, ramp up, production, and have it, as much around the world as possible.
Thank you. Thank you. This is really important sitting in Bangladesh where there's huge vaccine shortage. I teach gender reproductive health and rights, and I remember discussing the whole patent and control around HIV drugs, and how South Africa and India were finally allowed to manufacture their own drugs because there was elections and domestic politics. And I think what it raises issues around where is the accountability of solidarity universally, given this is a global pandemic, and these issues keep coming up again about, pharma industries, pricing, medicines, and access, and how it trickles down in different countries and national policies. And I think these are very, very important issues that need to be addressed. And congratulations. And I'm not surprised it's the South leading these calls, because in some ways we're the most affected by these inequities, because, I have family in Australia, and I know people in Melbourne who don't want vaccines. Whereas in Bangladesh, people want vaccines, but there's nowhere to go to get vaccines. And the government has actually done a very good job of trying to get vaccines. But to your next question is to fire up the webinar a little bit more, because gender issues are at the heart of some of these discussions, but inequalities and equities at global, local, national, regional levels is how will the calls from feminists or your groups or the network that you're doing address some of this? How can we kind of avoid this, or what are some practices, or at least some steps that one can take, or all of you as a movement are taking to kind of challenge some of this? Very briefly. Thank you.
Just a few days ago, there was a report that came out that the United States just basically threw away 15 million doses of vaccines, right? So the hoarding and then, that kind of news makes you really realize the deep inequalities and how we have to change that. So, and as was shared earlier by the other panelists, when the pandemic broke out, the women's movements, which are very strong in different ways, have been so involved in HIV and across so many issues, the intersectionality of it all. We were finding ourselves really not ready because the system did not give us even the ability to give the data, right? So back in early this year, Dawn, which is a very well-known Southern rooted feminist organization that does amazing work on looking at structural issues, and TWN, we've been partners for a long time. We got together and we launched a campaign in May with a website, which I can share later on Feminists for People's Vaccine. Now, because the idea of vaccine equity has captured the structural inequalities for the world. But we are talking not just about vaccines. We're talking also about the therapeutic drugs, the medicines that will help us to deal with, because, and vaccines are not going to give you immunity. We see that happening, mutations, etc. And testing kits, diagnostics, chemicals, masks, ventilators, they're all wrapped up in the whole range of different types of intellectual property. So for us, the Families for People's Vaccine is about access to all the medical products that we need for COVID-19. And what do we want to do? We want to inform and mobilize, because we realized all the gaps of research and information. And we want to be able to get women across And we have to pay attention to gender and intersectional inequalities. We all talked about it, LGBTQ, people with disabilities, young people, girls, migrants. So in this region, it all comes together, really, I guess in Asia, really very, and we want to do advocacy. And we've taken up the waiver issue in a big way because we have to unlock it so that we can have technology sharing and transfer. When we hear things like you in the developing countries have no ability, to manufacture, that's not true. From Vietnam to Indonesia to Malaysia, where I'm coming from, Thailand, we have the capacity. We just have the legal barriers of intellectual property. We got to open that up, and we want to engage and be involved. And we need to we talk about governments and local communities, but really we have to attack, the systemic structural problems. Because Dawn in TWN, we take all the issues around inequalities and gender disempowerment. It has to be in the context of social and economic justice. If we don't do that, and frankly, it was disappointing that the Gates, I wouldn't say the foundation, but Mr. Gates played a very big role in persuading the Oxford Institute team not to turn that into a public good. What today we call the AstraZeneca vaccine. I think that really was a milestone moment, and it didn't come. So I have to be quite honest. I think we need to deal with a lot of the issues around the supporters of the pharmaceutical system as it is. The reason why the EU is so hardline is because the pharmaceutical industry is very, very heavily lobbying, even in the United States, right? So we have a long way to go, and we need to really have some of the biggest foundations like Gates that funds the WHO. We need to really have the public good back at the center of health.
So I think, this is really, most of us are aware of this if we're working in this, but not to the extent maybe. And I think this is extremely useful, a critical perspective on what's going on in terms of accountability, but also the kind of messy spaces that, stakeholders, funders, organizations also occupy, wearing multiple hats, which could be either they facilitate the process, but at the same time could even serve as barriers for various vested interests. These are many different actors. I thought it's very interesting, Yokling, and we're going to wrap up with this question. And I want to do a quick, maybe a minute to Kira and Gunjan, just a minute to respond, not even just to this, but to add to this. But Yokling, I was wondering in terms of research questions, because you talk a lot about, basically you're talking about a socially just model for the world and has implications for the future. This is not the first global pandemic, nor the last. We've seen many different kinds of diseases afflict the world, and patency and control and medicine costs have been drivers amongst other factors. Are there any particular research priorities or agendas, if you could say that? And then I'm going to quickly go to Kira and Gunjan just to kind of share a few thoughts. And then we're going to go to Dr. Selena Low around interventions and insights.
I think one of the major areas that groups like TWN and Dawn and our partners really want to focus on is that we need to look at research around gender and intersectional inequalities, but in the context of social and economic justice. There are very few economic activism, within the women's movement, because it's also linked to the lack of education and opportunities, right? There are very few economists who are progressive, who are activists, and we need to build that up. So we are there, but we're not enough. And we need to be part of the decision-making, part of the shaping of policies. And I think we need to have research that actually looks at those structural problems. And we need to work with the groups across all continents. And so I think that's for us very, very important. Disaggregation of data and all that, it's been going on for so many decades. Every time there's a crisis, we say we don't have disaggregated data. Why? Why is something so fundamental still not available? But there is a lot of data gathering, all right? From Fiji to, to Latin America, the groups on the ground, the women's groups especially, are gathering the data like nobody else. How do we, in research, in the formal sector, recognize that data? So I'm very excited by what the projects have been done in shared this morning. I think that we need to structure that involvement, and I think the UN is very, very key, to play that role. The WHO has been kind of sidelined, frankly, in the COVID response, because the WHO is not equipped to deal with pharmaceutical industries and to negotiate, right? But it has to play a central role. As Dr. Tedros said, if we don't do it now, when do we do it for the waiver? Because it's our right, it's our tool.
Okay, thank you so much. So what I might do is, Kira and Gunjan, if you could be patient for a couple of minutes. I wanted to go to Dr. Selena Law, who's here, who is basically, Executive Director of the Australian Global Health Alliance. and ask to her for share a few insights from Australia and the Pacific. Do we have Dr. Selena Lowe here? I can't see her. That could be just my, yes, we do.
Hi,
Okay.
Sabina.
Hi, how are you?
Hi, Sabina.
How are you? So can I get you to share in about 3 minutes some of your kind of insights and interventions, and even responding to all the speakers if you were here throughout. If you can do it all of it magically under 3 minutes, that would be brilliant. But thank you very much. Yeah.
Thank you very much. It's really a pleasure to be here. Lovely to see old friends, Kira, Yukling, Lavinia also. I'm here in my capacity representing the Australian Global Health Alliance, which is a national peak body of global health organisations and institutes in Australia. We're also the Secretariat for the 56 WHO Collaborating Centre Network, and also the Secretariat for Pacific Friends of Global Health, which is an advocacy partnership with Gavi Global Fund and UNITAID. So my background is actually in access to medicines. That's how I first met Yukling. But in more recent years, I actually moved on to planetary health. So I'm going to share, which we all do, you know, from framing from my own experience, but also the work of the Alliance. I really think this is an important theme to take up right now. And I really appreciate the continual focus on intersectionalism and also on social justice. Here in Australia, as you probably know, our own national response has been hampered by various reasons, and notwithstanding is like vaccine hesitancy, but also procurement and supply, which really over a year ago during the pandemic was announced by global experts that national stockpiles and pipelines should already be established months and months ago, but they clearly were not. And then when you reflect in terms of the region that we're purporting to support, the Indo-Pacific per se, with all the various donors and partners, it's even more than patchy. I completely agree with Yukling in terms of local capacity, manufacturing capacity. All those barriers have to be removed as common goods for health, global public goods, whatever you want to call it. But all these mechanisms need to be activated to do that, and kind of joint action. But I would make 2 points, and that is we're quite focused on, as an alliance of members, on gender equality and climate change and health security. And although they might seem like very separate entities, I think the commonalities in terms of vulnerability, Gunjan mentioned vulnerable populations, which often in global health we talk about, but I would go so far as to say that it's perhaps even more than that. It's vulnerable situations, vulnerable contexts. I can be here in Melbourne and become vulnerable through the context of whatever natural disaster. Of course, I start in a different place than someone in a small island in terms of climate change, but they're together somehow. And in terms of our collective response as donors and as research partners, I think our research has been the research agenda priorities have been quite good at identifying these links. But in terms of our response, we're still keeping ourselves in silos and competitions between various thematics, and where we can find those sweet spots to, jointly partner and have a more holistic approach to our programs and the interventions that come from good research would be a good thing. So that is my intervention. I hope it's under 3 minutes.
No, thank you. I think it is. I think we've got Lavanya, the main boss, managing all of our time. So I just wanted to say very quickly, I wanted to go around asking everyone, because we're kind of talking about structural issues, power, politics, agency, but we're also talking about some really interesting work being done on the ground. Wipro shared some ideas and suggestions, and Gunjan also shared some possibilities. I think Yukling reminds us of what we're up against, but also it's something that can be managed and it needs to be sustained, and we need to discuss some of this stuff critically. I've seen, Lavanya, that you've asked Anjana Bhushan from WHO Sierra to share her comments in chat. Is that okay? If we kind of do a rapid fire with the rest of the colleagues? Lavanya?
Yes, please. Go ahead. Thank you.
Okay. So can I just go to Kira first, then Gunjan, and then Yokling, but really under a minute. Otherwise, I'm going to be in a lot of trouble and never be asked to come back again to moderate ever again. So Kira, yeah.
Thank you so much, Sabina, and I hear you. So I think the one thing I would say is that I think our work in terms of addressing gender differences in COVID-19 vaccination really require putting communities at the very center of our strategies. And I think that really, again, it sort of entails meaningfully engaging and collaborating with communities and community leaders in our research efforts, from the design stage to the implementation of knowledge mobilization. I would also say, I really took the point around disaggregated data. That continues to be a challenge, but I think it's also important that we go beyond collecting quantitative data and also start thinking about qualitative data and including data that really speaks to the different determinants of health to really better understand the different barriers of those that are most vulnerable. And then I would say that we also need to really support community organizations by really building and strengthening capacity to enable this collaboration and also to sort of engage in our own research efforts. And most importantly, I think we must share that knowledge that's been generated with communities to further support evidence-based and equity promoting programmatic and policy changes. And if I'd had more time, I would have spoken more directly to how we are doing that as part of not just the CSO initiative, but also with the research initiative that we are doing with community engagement across the region.
Share that in the resource in the chat box. Gunjan, can we quickly hear from you? Some final thoughts? Yeah.
I think from the foundation's perspective, we are pretty clear that each voice matters. I think we are the voice here. So let us, as I said, come together and amplify the voice. And unquoting, the other thing that we need to do, and going back to some of the words that you just used, structures, power, politics, agenda setting, I think it's also imperative for us as a group as to how we communicate. So possibly we also need to look at the mechanisms of communication about all these aspects to people who actually matter. Let us simplify also our communication, demystify. I'll use democratize as a word, but let's also move away from these hard-hitting words. Let us keep the process simple and reach out then to people. I think every individual, that's the ultimate goal, even if COVID vaccination is taken as an example. But let us get together, keep things simple, and keep on pushing and moving in the right direction. And there has been a lot of change. If we look at how things stood at, let's say, even 5 to 7 years back, the pandemic is an opportunity to further amplify those voices. So I think let's just keep on doing the work which all of us are doing, and also possibly collaborate and coordinate a bit better.
Okay, so speaking to each other, and having some sort of accountability, but in ways that build bridges, is what Gunjan is suggesting. And of course, I've simplified what he was trying to say, but thank you very much. And Yokling, very briefly, and then maybe Selina, very briefly, and then we just wrap up. Yes.
Well, I think the multiple crises that have come together, it's always been there. We've been fighting them for a long time, and COVID really amplified it. Now we have countries which are going to new levels of debt because we are borrowing money to deal with COVID, including buying vaccines, which are overpriced, and medicines will come, and we have the same fight in shortages. So we do look to the UN. I think for us in the civil society activism, we look to the United Nations, and we see the kind of collaboration that is needed. We want the UN, the multilateral space, accountable also to people, not just and governments to us. So I think that's important. I think we want to communicate, but we don't want to be simplistic. I mean, we want women to be able to go to the World Bank and the IMF and to the WTO and make their demands, because on the ground, the repression and inequalities are so deep. I don't think the women are going to say, I'm going to be nice to you, right? Because there is a lot of repression and inequality. And lastly, I think it'd be very important for us to have a systematic, structured way for the engagement and involvement of feminist civil society actors and the different coalitions, so that we can actually get into working together in real partnerships. We've just, like a week ago, the Families for People's Vaccine submitted a shadow report to the CEDAW committee, invoking the accountability across borders of member states in
Thank you.
in
Thank
countries.
you.
So
Like,
we
if you
want
could
to use
share
the UN.
resources in the chat box, that'd be great. As I said, if we could do this for a week, probably weeks would be very helpful given the vast knowledge and experience and commitment everyone brings to the table. I'd really like to ask someone we all know, Professor Gita Sen, to share a few words while she's here. Sorry, Selena, you're gonna have to wait a few minutes, but it would be great to take advantage of Professor Gita Sen. Any thoughts or voices or views based on what you've heard so far? Have you got a few minutes to spare?
Sure, it's a little bit out of the blue, but
yes, but you probably are used to this, getting roped in even just by attending. That's something you have to live with.
By a hair and a thread at the last minute. Let me just say, first of all, that it's been really fascinating listening to the speakers about the kind of work that's happened in the region. I think, Kalani, that report really sounds fascinating. It's been on my reading list for a little while, but now I really will go and look at it. It sounds great. And Kyra, the work you guys are doing in the Western Pacific, because my other hat is a Dawn hat, and because the Dawn Secretariat is actually based in Fiji for quite some time, we're very committed to and involved and knowledgeable, I would say, about what is happening in the Western Pacific on the ground. So it's really interesting, I think, the kind of work that you're doing. I do think that one of the most important things for us is, in fact, embedding the economic and intersectional inequality concerns within the structural, the gender and intersectional inequality concerns, embed them within what is happening in the economy. As an example, one of the challenges we faced in India for the longest time was inadequate fiscal support for migrants and households in need. And so we can't only focus on whether women are getting vaccines or drugs at the same rate as men are. That's a very narrow approach to inequality. If women's jobs are falling apart, if unpaid work, because the labor market is simply not picking up, if that remains and becomes a huge challenge, those are the kinds of structural issues that pull together what we might see as gender inequality within the household to the larger concerns on economics and politics. And I would think in the region, we are well placed to make those connections. We've been saying it for a long time, but really not been able to push it hard. And I think we should use this pandemic as a way really to make that shift happen. Thank you.
Thank you so much. Once again, you remind us of the importance of some of these priorities and bringing a lot of the discussions together. I just want to wrap up now because we've run out of time. But just to say, we're reminded to think about what Kira, Gunjan, Yokling, but even Selena and Anjan posted some comments around women being at the forefront of health decision-making as communities, partnerships, local ownership, about context, about how do we engage with communities, how do we work with government, how do we speak to each other as partners, how do we talk about accountability, how do we move forward in ensuring the COVID-19 and vaccinations and gender, the gender lens is primary to this. And finally, I think methodologies are very important. I do think we have a certain valuing of certain kinds of data, but in the end, I do think longitudinal or qualitative ethnographic research can speak to some of the issues all of you've raised, and especially towards the end, Professor Gita, looking at, these sort of so these sort of intersections between some of these issues, but also sort of these different levels of vulnerability, different kinds of risk experienced by many, many different vulnerable groups. I just want to thank everyone for being here today, and I want to pass the final goodbye and session into Dr. Lavanya. Thank you very much. I really enjoyed learning a lot today. I think we confronted with many issues, but I wish you all the best on some of the really, really good work and commitment you're all showing to this work here. Thank you very much. Yeah.
Thank you very much, Sabina, and everyone that's present here today. Professor Gita, for putting you on the spot, Dr. Sabina. Thank you so much for making time for us. And, we've unpacked some very important conversations that, very often get neglected. So we are hoping that we get to continue the conversations. This is definitely not the last time that we would convene. As you've seen, 1 hour is too short of time. We can probably sit, as Professor Sabina said, we can sit for days and speaking about this. So before we end, I'd just like to take a quick shot of the panelists. So if everyone can, we've got all our cameras on back again. So Vidya, can you just take a very quick picture for us for keepsake?
Professor Gita, would you like to join us as well? Okay, I'll go ahead.
That's fine. Okay, thank you.
Thank you.
Sure. Thank you.
In 3, 2, 1. Perfect. Thank you.
So I'd just like to, before we end, just like to share ways that we can keep in touch, if that's okay. So here's our Twitter handle, our website, and if you'd like to hear more about the research agenda setting work, that's also, and the discussions that we've been having, it's ghhbudgeport.org. Please look out for our upcoming journal series, where we will be publishing on the analysis and the conversations that we've been having. And so we look forward to engaging with you throughout the year. Thank you so much for your time.
Thank you very much.
Thank you.
Thank you. Thank you very much.
We'll just give a few minutes for the thank yous to roll in from the participants and for them to also catch the final few links that we've put in the chat.